Hello, hello. Today, we in LifeRx, we're going to talk about TMJ. So many clients come in our clinic or we go to the houses and they don't even know they have a TMJ problem. They say, oh, my neck is hurt. I have a headache. I get that sound in my ear. And this is the TMJ. So what's the TMJ? TMJ, it's a mandibular temporal mandibular joint, which is right in this area. It's connect. Let me show you on JB. It's your jaw. That big bone is called mandibular bone. So it's a lower portion of our jaw attached to your skull. And this is right in here. Why? Because it's a temporal bone, and that's what is called as joints. And a lot of people experience pain in this area, tension, and that's why it's a TMJ, and it's a dysfunction. So it's everything. Do you guys have any questions? Let's talk about if you have any questions. I love to talk before we go.
What about whiplash? If people get a whiplash in car accident?
Yes, yeah, whiplash. It's really coming. People after car accident because that. Think about it. If something coming in your back or on the side, whatever happened. If someone hit me in the back, my whole body, my whole energy coming forward and after back. I injure my sternocleidomastoid. It can be affect my TMJ. Of course, it can be TMJ. Maybe I don't know. Maybe I drink my coffee and I hit something. I hit my teeth. My jaw is kind of pumping back. I played basketball once and the guy threw the ball in my face, and it's just get that hit in my lower jaw and it's clicked. What's usually happen if you see those knockdowns where people get a straight punch right here in the jaw, it just get that click and your brain is shut it down. So the person get knocked out. So he's like, and you can see the people like standing like this and they doing that. They like stuck. Why? Because it's a nerve connection, everything. And that's why they think, that's why they do it. Because they punch in that jaw. All right, so people come in, they don't know about TMJ. They just come in and say, okay, I have a neck pain and I have a pain around that ear right here, all the way down. And I ask people, do you have any experience TMJ before? And people say, no, I've never been diagnosed with TMJ. And that's or people are gonna say, oh, I've been diagnosed with TMJ, which is good. You don't need to do any tests. You don't need to do you still need to do tests. Yes, you still need to do tests. But people don't know the TMJ. I always do couple tests. I place it right in here on that area. If you not find it, open the mouth and close. You will find that right where is that kind of space coming up. And what I feel, I'm applied 2-3 pounds pressure. Is that pain? Any pain?
No.
No, it's good. And also what I'm feeling at the same time, if anything, if different between that side or other side. So I'm just, like I said, attach it and she close. And what I'm feel, actually, one more time. The right side, which side are you chewing your food most of the time? Yes, you see, it comes up right away to me because it's completely different. When she's opening her mouth, the right side is completely different with the left side. And it's also the treatment, guys. Yes. So you always check that area.
We have to use both sides.
Yeah. Yes, both sides. You apply and you feel it. I'm already feel it's a different. Next one, I ask, of course, neck rotation. I ask person rotate left and right. See if any limitation here. You see this is limited. So I'm going to work on the sternocleidomastoid. Like I said, I'm going to look at the back muscles. I want to see open the mouth too. Open the mouth and close. I see if any clicking. I ask the question if you're grinding. Work on that muscle. If you don't know what you're doing, if you don't know what you're healing, if you still work on the sternocleidomastoid, you're going to help your client tremendously with whiplash, the TMJ, neck problems, definitely headaches, the blue revision. It's a lot of trigger points up there.
It's good feeling.
Is she like it? So, and watch, I can start all the way from that attachment all the way up from insertion to origin, squeeze and go all the way
to
up.
do it. I'm gonna try it later.
Okay, cool. Next one. This is not like a super deep. If I be like doing work, I put the gloves, go inside. But like I said, this is scary people sometimes. The first couple sessions, I will probably do that. And if it's help, it's help. It's good. You don't need to do scary people and pointing your fingers inside the mouth. You're not a dentist. Next one, I want to find that space where she's open the mouth and close. So close and open and close. Here we go. It's right there. All I do, I just apply that pressure with 2 fingers and she's open and close. Do it again. Right there. What do you feel?
It's good pressure.
It's good pressure. So yeah, I'm apply like a 10 pounds pressure. And all I do just, you can do 1 finger just like that. And close. Open and close. Perfect. Trust me, it's super sensitive. It's a lot of stuff going on up there. I just want to be gentle. Like I said, it's super sensitive. This is my grip. I grip this neck like this, and all I do, I ask her to do this. Here we go. She's already clicked. You see what I'm doing? Like I said, you can also apply the neck work in here. I work on that cervical area. But that's what I'm doing, behind that ear. If you don't know how to do it, just apply 1 thumb and move side to side. Is that doing okay? You can do, and the next one, you bring to this flexion, hold it, and ask it to do tuck chin. Tuck chin. Yeah, you see? That's amazing. I feel a lot of space now there. Exactly. So $6 can make you $1,000. Guasha in China, Greston in the Western technique. I think, of course, Western technique stole it from Asia, but that's all right. So I have this, look, I have this cupping with a tip, even the better. This is the cupping, and the tip. So I can apply the tip inside. Not this one. Yeah, this one is broken. Smaller one. This is what I have. This other one is bigger. So this is the small one. And look. So what I'm doing here, I'm apply right in this area, and ask her to open mouth. The problem is it's going to be make a little mark. I usually say someone punched me in the face, so that's how I explain. If you're, how's that feel? If she don't feel, I pull more.
No.
She feel it. You see? Yeah, and that's the grade for TMJ.
Oh my God.
Oh my God. Oh my God, she said, yes. She said, oh my God. That's it. When you release it, massaging, that's why I always have this in my car. Used to. Because you bring it back, you put it on the table, and you don't need to work. Guy with the shoulder, boom, 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 put my shoulder. He's massaging, you massage the other shoulder. Yes.
I feel good. I feel
Exactly.
feel it after that.
Why are we saying this?
It's good for my facial muscles and
Great.
wrinkles.
Yes. And what people do, they go to the plastic surgery. You don't need to go plastic surgery. You need to work on that muscle. You need to do massage, lifting, facelift, and all that stuff. And it's work. And if you have a deep TMJ, bad problems TMJ, I don't know how, but the Botox is the solution. People do Botox injection and it's released the TMJ. Only the problem is like you need like around 17 units, which is 1 unit is like $10. So yeah, you're going to spend a lot of money on the Botox shots, but it's work and it's help. And this is work too. and it's free. You put the cups, open and close your mouth.